The primary indications for high volt motor are re-education of peripheral nerves and denervated tissue, as well as reduction of muscle spasms. High volt motor should not be used over the heart, brain, malignancies, anterior cervical area, or on individuals with a pacemaker. Before application, be assured that the area is clean and abrasion-free. Explain to the patient that they may feel a pins and needles sensation and that a muscle contraction is to be expected. When using high volt for pain control, there are 4 recommended pad placements. They are directly over the painful site, distal to the spinal nerve root origin, over trigger points, or over acupuncture points. On the Solaris model, a lead should be switched to the high volt outlet. To change the polarity, simultaneously press the high volt button and the pause function button. When setting up high volt motor for pain control, the treatment time should be between 15 and 30 minutes. The pulse frequency should be low, the mode should be continuous, and the intensity can then be brought up to the patient's comfort level. The difference when using high volt motor for neuromuscular stimulation is that pad placement is recommended to be on the proximal and distal aspects of the muscle to be stimulated by the current to elicit a muscle contraction, thus aiding in re-education of the muscle. To achieve tonic contractions, increase the pulse frequency to 50 pulses per second or greater. For individual muscle contractions, the pulse frequency should be less than 15 pulses per second. The pad placement for motor level edema control is identical to that of neuromuscular stimulation. The reasoning behind this particular placement is that it draws the appropriate muscle contraction needed to produce a milking effect to assist in venous and lymphatic return. High volt motor decreases the permeability of blood vessels, which leads to less plasma proteins entering the extracellular fluid, thus reducing edema. This should be done in combination with elevation in order to assist with the venous return and enhance the effectiveness of the treatment.